Welcome back to Pain Diaries. Dr. Suzanne Manzi here with Performance Pain and Sports Medicine in Houston, Texas. I'm excited to introduce one of our patients and true believers in the therapies we utilize to change lives. Mrs. Kathleen Bomersbach is with us today to share her experience regarding Medtronic therapy, focusing on spinal cord stimulation. We appreciate you being here to share your story today.
Thank you. I'm really happy to be here.
So, can you tell us what happened to you medically and why we needed to pursue spinal cord stimulation for your pain in the first place?
Absolutely. I was an average, very active, very sporty 42-year-old woman. In fact, 2 months before my injury, which I'll discuss in a moment, I had won a fishing tournament over thousands of people. Won 8 different categories in it, did really well. I also owned a ranch where I bred white-tailed deer and was out every weekend, sometimes during the week as well, and all summer long, basically wrestling the deer, tagging them, inoculating them, worming them, whatever that needed to be done. But I was fully functional, fully capable, very handy 42-year-old woman. And then one morning, I woke up, and as I tried to get out of bed that morning, I literally fell on the floor. And then the wave of pain hit. It was such an all-encompassing pain that I really had no idea where it was coming from, or if it was just reverberating through my body somehow. I had no idea. All I knew was I was hurt. I could not walk. None of my limbs worked any longer, and I was yelling for somebody in my house to hear me, to come help me off the ground and get me to the emergency room.
That's really scary.
It was very scary. We found out that there was actually a tumor within my spinal cord. That's not very common. Normally, if you do have a tumor in the spinal column area, it'll be outside of your cord. Well, I was lucky, mine was within it. So it was actually blocking any spinal cord fluid from passing the L4 area of my spinal cord, which meant that I had cerebral spinal fluid backing up into my brain. It had started affecting my vision. This was all very quick. It all happened in an instant. I had no warning this was going to happen. And then coincidentally at the same time, my liver enzymes had shot up. I had always been perfectly healthy before that, and because my liver enzymes were so off, the doctors actually did not believe that I would survive the surgery. So, and it was imperative that we got the tumor out as quick as possible because of what was going on in there. So I had the surgery quickly within that time frame. They were successful in removing it. It was, however, wrapped in a very large nerve bundle, and to get it out, they ended up having to remove not just a simple laminectomy, but they ended up having to remove additional parts of my vertebrae. It caused catastrophic damage in multiple levels. It caused permanent neuropathy in my legs, and I had what's referred to as drop foot, if I could walk. At the time, I couldn't. I was actually bedridden for 3.5 years.
Wow.
I also had spinal arachnoiditis from it. So it caused a tremendous amount of damage. No walking, no being the involved mom that I used to be. So it was really a devastating experience. I kept my spirits up really well for the first couple of years, but after about 2 years of being incapacitated, that's when depression started rolling in, and really having that mental battle of this as well. And I'm so thankful to help carry me through this journey and to walk with me through it and get me to where I am today, which is miles away from where I was.
Absolutely. And I mean, I've known you for almost a decade now.
Yes.
And we've been through a lot together. And you physically don't even look like what you used to look like. You went through hell and back. And now, we went forward and offered you spinal cord stimulation for this chronic nerve pain that you were suffering from. And spinal cord stimulation it's a big deal, and it's a commitment, but at least you tried it on and you saw if it offered you any relief.
Right. Yes, I did. It was tremendous in finding their clinic, because any other pain management clinics that I had been to previously, it was about simply medicating. However, they were trying to go after the root cause and trying to go after reducing inflammation, reducing the nerve signaling, helping to redirect it to get my legs to properly respond to what my spinal cord was telling it to do. It is a difficult journey to go through the neurostimulation. You do go through a trial, but I would not be ambulatory had I not had the two devices. I do have two devices implanted within me. They're completely implanted within my body. There's no wires or anything visible, nothing like that at all. But I have a spinal cord pain pump and a spinal cord neurostimulator. And with those working at the same time, I am fully capable to basically push myself to furthering and furthering and furthering and getting back what I lost, getting back some muscle tone again finally. Mm-hmm. I can actually, this is huge, people who haven't been in this position don't understand, but I can walk downstairs, and I was not able to navigate even a single step when this all happened, and now I can go down entire flights of stairs in a normal pattern, and not just one leg at a time.
That's truly amazing.
Yeah, I had to really work up to that, and it was a challenge, of course, but it was such a gift to get there.
Absolutely. And what I really want to focus on, too, is Medtronic offers spinal cord stimulation as well as the pump devices with full body MRI compatibility,
right,
allowing patients to undergo MRI scans without the need for device removal or reimplantation. Now, for you, you had a spinal cord tumor.
Correct.
And so you're going to have to be rescanned.
Yes.
Which is why we chose Medtronic for you.
Yes,
because
exactly.
You need that MRI compatibility.
Right.
So the compatibility provides, several benefits for individuals requiring treatment with spinal cord stimulation. And so this is a huge deal, especially for your scenario.
Absolutely. I would not have been able to have a different device implanted because of that fact. The tumor that they removed is actually typed as a schwannoma, which is a tumor that regrows. So I'm checked often to make sure that the tumor within my spinal cord hasn't regenerated. And to check that, they have to put me into a certain MRI machine that only has a certain amount of Gauss magnets. So, but if I didn't have these specific devices, that would not be an option, and I would literally be playing Russian roulette with my body, because I would have no idea when and if the tumor would return. And I would have to go through that whole process again, starting back from zero. And this way we can actually be proactive and make sure that if there is a slight regrowth, we can address it before it becomes something where I'm not having spinal cord fluid going freely through my spinal cord. So yes, it's very important that I have the Medtronic devices.
No, thank you for sharing that. And, as a physician, at that time, yes, Medtronic was the one that was compatible. And so that's why we went with that device. Now, you have a battery, and the battery has to be charged.
Yes.
How often are you charging it, and how frequently are you, reassessing? Because I don't believe we've even replaced your battery yet.
No, we've only done one readjustment to it, and it was just, we had to move it from one pocket to another. So it's a little higher up on my waist right now. It's right here is my neurostimulator, and here is my pain pump. But yes, I do charge my neurostimulator every 3 days. And I can tell immediately when my charge is low. So, because I start having pain. My condition requires that I do have two devices. One device on its own was not enough to cover my pain. I would still have to be medicated. But with two devices, I am completely med-free off of any type of painkillers or anything like that, which that alone helps you recover so much of your life and so much of your personality and your joy of life in and of itself. So that was a huge, huge thing to me. But every 3 days, I just charge my battery. Usually it'd take about an hour. If it's because I've lost a lot of weight, it does turn position. If that happens, then it'll take a little bit longer, but normally just about an hour to recharge.
That's great. And I mean, you talked about opioids, and when I first met you, we were on opioids. And
yes.
We were still on opioids for a little while until we transitioned you to the actual intrathecal pain pump, where the opioid is being infused directly to the spinal cord. So it's less mentally slowing. You're able to be more active without being married to us every single month to get prescriptions, and that kind of thing. And you have grandchildren. And you don't want pills around your house.
Exactly. And I felt literally horrible on them because I had to be on such high doses and fentanyl. I had to be on 3 different types all at the same time to manage my pain because my pain levels were so high. And yes, I have 3 grandchildren, and I like to be a granny who's very involved in their life. And of course, I couldn't pick them up before, and now I can pick them up, toss them around a little, But yes, it's tremendous. And then not, like you said, being tied to opioids or having to take them orally. With what I have right now, it's microdosed directly into my intrathecal space. And it's not going through my liver, it's not going through my system, it's not causing the side effects of opioids, which were sweating. I would have big crashes. It was mood instability, it was sleep instability, just so many different things. It affected my personality, it affected my joy. It really, really was difficult. So I was so thankful when these options became into my and you're right in front of me that we could do this, and turned me a little bionic, and now I can do more without having to be stuck and chained to taking pills.
And you have the mindset too, where once you start up feeling better, you're like, oh, I want to get back to my old life.
Exactly.
So you slowly started doing your rehab and working yourself up and going to the gym and improving your muscle mass, which is huge because your depression was lifted.
Yes.
And it's not like we treated you with antidepressants.
Nope.
We just fixed your pain, which is truly
that was the root.
Yeah, for sure. The root cause.
That was the root cause, was my pain. It was literally, just ripples in the water coming out of that pain. There was so many layers that affected my life. But yes, I work out at the gym 3 days a week now with a trainer she's tough on me. But she's done an amazing job helping me regain some muscle tone, regain some strength. My balance is so much better. And like I said, I can go up and down stairs now. I can actually, this is a big deal for people who have had traumatic spinal cord injuries. You normally cannot wear any shoes that have a little bit of a heel. I can actually wear shoes that have a little bit of a heel now and feel like a woman. So that's nice too. That's like a little extra side bonus.
Absolutely. What would you say to people who have hesitation when it comes to implantable devices?
Obviously do your research, because I can't tell you what's right for you. Only you can decide that. But I wanted this so bad. I wanted this bad enough that I wanted to go through the process. I wanted to go through the trial, see if I could handle it mentally, see how this worked with my body, if my body responded to it. And I'm so thankful it did, and I'm so thankful that I did go through that process. It can be long at times. It can feel like it's just not happening quick enough. When you're in pain, you want things immediately to help fix you. But it literally, going through all that, I look back now and I'm just so thankful that I did do it, and I followed through with it. And then I didn't let my fear of, there's so many things that go through your head when you have an injury like this, and then also when you have a remedy that's, high tech, you want to, and there's not a lot known to the common public about it, but do your research and, know that there's hope out there, that if I can go from not being able to walk 3 steps to get into my bathroom every day, that, and to now I'm going up and down flights of stairs, I'm working out, leaving it all out on the gym floor. I can go for an hour and a half long walk around my neighborhood with weights. I can physically do so many more things than whatever would have been possible had I stayed on that old route of just medication. This is just a totally different ball game, total life changer, and there is hope at the end of this.
There's hope, and try it before you buy it, right?
Right.
You have that trial phase.
Yes, you have the trial, and it is necessary, and I think very important that you do go through the trial because to make sure that you can mentally handle it.
It's worth a try.
Yes.
Anything's worth a try,
Exactly.
I think, especially to reduce pain. So, Ms. Bomersbach, thank you so much for being here with us today to talk about Medtronic intrathecal therapies as well as spinal cord stimulation and how it's changed your life. We appreciate you.
Thank you so much for letting me share. Thank you.
I'm Dr. Suzanne Manzi, and this is Pain Diaries.